men, sexual health is often perceived as straightforward. It either works or it doesn't, almost binary. There's even a widely known solution, the infamous little blue pill, that has become a symbol of starting the conversation around men's sexual health. But for women, it's a little bit more nuanced. Sexual health isn't as easily defined by a clear-cut measure of functionality. It encompasses a broader spectrum of factors, with hormones playing a particularly significant role. So let's talk about it. Let's talk about some of the sexual challenges that many women experience, such as painful intercourse or a lack of desire. Is hormone replacement therapy a solution? These are all important aspects of the conversation. Dr. Jacobson, your thoughts?
Sexual function is something that affects so many women and something that is so underreported because women either don't feel comfortable talking about it or physicians don't have the time or the interest to bring it up and talk about it with their patients. I think what women need to know is that there are many more drug-associated treatments that are available for men, but there are options available for women, and that when it comes to sexual dysfunction, this is very multifactorial in that it's not just a simple hormonal problem, but so often has to do with the way the mind and the body interact. So this is a big conversation.
It's a big conversation, and ultimately we're human. We need to be touched. It's important to talk about.
So true. We as human beings do far better when we're touched. Think about when I say, you are touched. It has emotional repercussions. Touch is love, touch is understanding, touch is acceptance. And here's the medicine on it. It reduces cortisol levels. It improves immune response. In fact, natural killer cells have been found to go up in response to touch. Children who are not touched have failure to thrive. They don't grow as well. They tend to be more aggressive. Do we need touch? Yes, we do, and at every age, and it's a conversation that needs to get in.
How about hormone replacement therapy? Is that something that has worked for you?
It actually has worked very well for me, and my GP sent me to a menopause specialist to weigh, because I was diagnosed with osteoporosis, to weigh the benefits of HRT with relation to strengthening the bones versus the detriments and the risk of breast cancer. And it was determined that the benefits for osteoporosis, for bone strength, was in my favor. Of course, you get all the wonderful side effects of hormone replacement therapy. So you do not have vaginal dryness. You do feel like you've always felt. Your skin feels more supple. Just my personal experience. And of course, when your estrogen levels are higher, you feel more like you've always felt.
Yeah, Dr. Jacobson, what do you advise your patients as far as weighing that risk?
So hormone therapy is recommended as the first-line treatment for women who are suffering with the side effects of menopause, primarily vasomotor symptoms, which are hot flashes and night sweats. In countries like the US, the other indication for using hormone therapy is for women who are at risk for postmenopausal bone loss, which is actually all women. In my clinic, I am a menopause specialist. We have individualized discussions that weigh the risks and the benefits. Hormones have gotten a very bad reputation for the last 25 years, mainly due to the way study outcomes were reported in the early 2000s from a large study called the Women's Health Initiative. But really, the dialogue has changed. We are learning physicians how to prescribe hormone therapy. We are teaching people that hormones are not necessarily dangerous, and this really needs to be an individualized discussion.
What is it about aging and menopause, and women in particular, and then we'll get to men in a second, Dr. Zlotta, that makes it more difficult for us to achieve an orgasm?
Well, what happens is as we age, our estrogen levels drop. That's because the aging ovary becomes less capable of producing estrogen. And estrogen has so many different effects on our body. It plays a role in the amount of mucus we make. It plays a role in how thick the skin is on the outside, the mucosa of the vagina, the thickness of it. So all it takes is one really negative, painful experience to change the trajectory of sexuality. So this is a conversation that needs to happen because it's so amenable to being helped. The Menopause Society is recommending, as a first line, using Premarin cream, which is an estrogen cream on the outside, that does not increase the risk of breast cancer, to try to address this.
There are differences for men, Dr. Zlotta, and in my introduction, I described it as almost a binary. It either works or it doesn't, but erectile dysfunction is very serious for men as they age.
Absolutely. If I may, I just would like to get back to the bladder cancer story, where I think it's important to say that it was the sexual function in women was completely overlooked. And I think more and more, especially as this affects younger women, there are both surgeries where the sexual function can be preserved, and too often people didn't even think about it, but now it can be actually entertained. And there are also new treatments where the sexual function of women is preserved as well. So I think we're moving in the right direction, and this sexual function in women, it becomes more and more important. Now, getting back to men, you're absolutely right. It's a binary situation, although I would say that it's way more complex than binary. And I'm going to take the example. When men have a radical prostatectomy for prostate cancer, the prostate is removed, the seminal vesicles is removed, and they have no ejaculation. And it's interesting to speak with those men. They then describe, although they can still have sexual function because their erectile function is maintained, they have another type of pleasure. And so although, yes, it's a binary issue, even among men, it's way more complex than the binary problem.
Jane, I'm going to give the final word to you. Any positive sexual changes as we age?
Oh, absolutely. It comes with being with the right person, a partner of many years who you trust implicitly with your sexuality and your desires. I think that that is first and foremost. And then when the body functions well, it just enhances the whole experience. But as you age, sex becomes so much more than just intercourse. There is so much more about exploring each other and about feeling sexual without maybe even having to have penetration. So
Yeah.
it becomes more of an adventure as life goes on.
And as they say, practice makes perfect. When we come back, we'll get to some of your comments and questions next.